Let me introduce our next speaker, Prof. Lydia. Prof. Lydia Abdul-Latif is a rehab physician and the Chief Medical Officer at Regen Rehab Hospital. Her specialty is in neurorehabilitation and her key interest is brain neuroplasticity and recovery. She treats a wide spectrum of conditions, including stroke, cerebral palsy, and Parkinson's disease, and has published in peer-reviewed journals locally and internationally. Over to you, Prof. Lydia.
Hello, everyone, and very good afternoon. Thank you, Tracy. Thank you to EP Plus as well as Alpro. I'm a consultant rehab physician in Regen Rehab Hospital. And so today I will discuss a little bit about the brain after stroke, looking at the concept of neuroplasticity, how to promote stroke recovery, and the importance of stroke rehabilitation. So why stroke is important? I think we have mentioned that the third leading cause of death, and 1 in 4 adults above 25 will have a stroke in their lifetime. It is a leading cause of death, a leading cause of adult disability, and about 60 to 70% of stroke survivors in Malaysia are either moderately or severely disabled 3 months post-stroke. So if you look at the disability adjusted life years worldwide, stroke is represented in the dark blue color. So you can see that across all age groups, stroke is quite significant in causing disability compared to all the other neurological conditions. So if you look at the survival and how does the brain heal, 2 types of stroke. For ischemic stroke, their 30-day survival is 70 to 80%, as well as the intracerebral hemorrhage stroke, their 30-day survival is 36%. So they would survive, and how do we actually deal and what do we promote in terms of a recovery of these 2 types of stroke? And following a stroke, patient will have suffered many forms of impairment, not just one. They may have 3 or 4. So this will include motor impairment that will affect their limbs. They may have thinking difficulty. They may have problems with the vision, communication. They may have pain due to sensory deficit, and all this will result in disability. For example, they may get a lot of depression. They're not able to walk unassisted. They have got social disability, and this may result them being institutionalization. Okay, so now we look at the brain after stroke. Brain after stroke mimics that of a developing brain for about few months after stroke. And what do we mean by a developing brain? It's almost similar of a brain of a child, which is like a new brain. Hence, the brain is actually very receptive to learning. And this is due to the fact of the attributes that they have, which is called neuroplasticity. So neuroplasticity is actually the brain capability for change. All right. And what kind of change? It is the adaptive change to improve the impaired neural network using the survival neural network. All right. So this is what we term as functional reorganization. So if neuroplasticity is enhanced, functional reorganization can be facilitated, and this will lead to acceleration of neurological recovery. Okay. So then we know brain reorganization, it has a significant capacity to reorganize, to recover from the loss of function. Reorganization of the brain depends on training or rehabilitation, and it will not occur spontaneously. So this is actually illustration looking at the time frame for stroke. Basically, what I want to highlight is that stroke recovery is very, very time dependent. So the acute phase, where the patient will actually be in hospital like Dr. Funky, will be within days. And following that, up to about 3 months, it will be considered a subacute phase. And after 3 to 6 months, it will be a chronic phase. So during this, a lot of things will happen to the brain. But you can see that we should have a targeted goal of neural repair, starting from the early days up to at least the golden period of 6 months. Okay, so this is where you can see rehabilitation plays a role in improving and reducing the disability, if you look at this. So generally in our group of patients, usually after a stroke, they will be hospitalized for the acute treatment. And then if they're lucky enough, they will be admitted for inpatient rehabilitation, or some may even end up in a nursing home. And then when they are well enough, they go home to continue their home rehab, and then they attend outpatient. And then they will be discharged. So this is where acute hospital, rehab hospital, NASAM plays a very important role in this network of delivery of healthcare for stroke patients. Yeah, so each of the center and organization has a timely role to help with the recovery of a stroke patient. So you need to know when to go where, right? So the continuum of care is very important. You have got the acute care combined with the rehabilitation. Hence, you can promote a much better and faster recovery. All right. Okay. So this is the golden period of stroke recovery, the timing of recovery. Like I said, this is based on scientific studies that showed if you look at the first few days, there will be an increase of recovery, and this can take you up to about 6 months. Okay, so this is where the golden period of stroke. So what do we do with this golden period? All right. So we understand about the neuroplasticity. It is how the brain adapts to changes, how the brain learn new facts, develop new skills. So in order for us to promote recovery, we know that the brain is very receptive to learning. The brain will learn from experience. So we need to provide the experience to the brain. So rehabilitation is one of the experience that is used for the brain to learn. Okay. So in stroke rehab, first thing that we do is we identify the impairment. We pay careful attention to the medical issues. We then direct an early goal-directed treatment. We do systematic assessment of the patient's progress so that we know how to change and modify the rehabilitation program. It has got to be done by experienced multidisciplinary team. And then we provide patient and carer education, as well as provide a comprehensive discharge plan. So all this is to provide, to start as soon as patient is ready. And we must look at the intensity and frequency, task-specific training, which all these approaches is to promote and facilitate neuroplasticity. So what we mean by intensity, it has got to be enough practice to learn new means to improve on the skill. Task-specific training means the practice of a desired function. Early therapy is to take advantage of the brain's neuroplasticity, which is the golden period of recovery. Okay, so usually in rehab, we don't work alone, we don't work in silo, we work with a team. Usually we have got physiotherapists, occupational therapists, speech language pathologists, we have got rehab nurses, we have got the rehab physician. We are also supported by the neurologist, the geriatrician, and the most important team member is actually the patient and the carer. Okay, so we have to look out for the medical complication during rehabilitation, because all this will hinder their rehabilitation and recovery. Things like spasticity, depression, a seizure, infection, all this may not manifest early, but usually later in stroke. Yeah, so we tend to see them often in rehabilitation. So there are also neuropharmacological agents that may be useful depending on the patient, depending on the impairment. Things like all these teratogenic agents, dopaminergic, things like fluoxetine, paracetam, amantadine, neuroaid. So we use this in stroke rehab and spasticity. We do oral medication and as well as botulinum toxin injection. Okay, so we look at the rehabilitation to facilitate neuroplasticity. There's an array of approaches, but basically the approaches would be to facilitate neuroplasticity from the very basic right to the very advanced. Okay, I think the physiotherapist is going to describe this in detail. Okay, all right, so the essential thing is that stroke rehab is essential component of care. It aims to improve health outcomes, minimize complication, improve function and quality of life. It needs to start early during acute phase, right till recovery. It is very goal-directed. We have to move towards restorative approach instead of just compensatory. And there's a lot of emerging techniques that we should also consider. So I'm just going to end this with a very short video.
A lot of patients need rehabilitation care, especially patients after they have suffered any form of neurological condition, most commonly like a stroke. Stroke rehabilitation needs to be done in a very timely and appropriate with a very structured program.
Rehab nurses are specially trained to provide 24 hours care for individuals with disability. They will perform ongoing assessment, assist patient with medications and self-care, reinforce the technique learned in their daily therapy sessions, and coordinate care with other team members in achieving rehab goals.
Stroke patients, they can have complications such as pain, spasticity, even depression. And to address their physical needs, they need physiotherapy to assist with their mobility, for example.
In constraint-induced movement therapy, we will make sure that a good side will be constrained and patient have to use the affected side to do them, which is not easy. And apart of that, we do something called functional electrical stimulation, FES they call, which does a lot of stimulation to any part of the body, which will help the brain relearns that movement, and that will help patient to get that movement back.
So there are emerging technologies to assist with stroke rehabilitation. For example, transcranial direct current stimulation. So the whole concept is actually going back to the hypothesis of enhancing the brain function through neuroplasticity. Rehabilitation is an important component of patient continuum of care.
Okay, thank you very much. That's all my presentation. Over to you, Tracy.
Thank you so much, Prof. Lydia. All right, I'm trying to get my video running. I have a question from the audience. There's a lot of public awareness about the role of physiotherapy post-stroke in post-stroke recovery. What he wants to know is, can Prof also further explain to us, the public, on the importance of having a rehab specialist in post-stroke recovery journey? So I think they're asking about what is the role of the rehab physician?
Okay, so the role, as I mentioned just now, rehab is a multi-component, stroke rehabilitation is a multi-component because there is medical issues that need to be sorted, there are physical issues, there are functional issues, psychosocial issues. So as a rehab physician, we will actually address the medical issue, ensuring that the patient is suitable for rehabilitation, dealing with any medical complication during rehabilitation, and try to optimize neurorecovery during the rehabilitation process. So we work hand in hand with our other rehab professionals, such as the physiotherapists, occupational therapists, specialists. We plan, we individualize patient programs. So this is part of our role as a rehab physician.
Thank you so much, Prof. Lydia. Can I ask another question? This is the one everybody is quite curious about. Without rehab, can you actually achieve recovery? What happens?
Okay, so that's a tremendous study that has been done. And the golden period is not something that we pinch from air. All right. So like I said, the brain is very receptive to learning. Okay. So if they do not do rehabilitation, the recovery is not going to be complete and it's not going to be fast.
All right. And the other one is, are there any other options to recovery? I mean, is rehab the only way? Are there any other options?
Like I said, the acute treatment has got to be very optimized. The prevention of stroke is the most important thing. Managing the medical condition is very, very important because you do not want recurrent stroke. But if you're also asking about alternative care like acupuncture, massage, those are still something that can be considered. There's no sufficient evidence, but it doesn't like a lot of our patients go for acupuncture, and there are some benefits of acupuncture, for example, in improving patients' well-being. So those are things that some people do use in stroke recovery. It's just that it's not evidence-based.
Okay. I'm trying to read the questions here, so give me a minute, sorry. There's a question here that says, where can we find rehab hospitals or centers throughout Malaysia?
Okay, so rehab hospital is available now. So we have got the National Rehab Hospital, which is called Hospital Rehabilitasi Ceras. So that is a national rehab hospital. And then we have got two private hospitals. The first one is Regen Rehab Hospital, the one that I'm working in, which is in Petaling Jaya. And the third hospital is actually Dehan Rehab Hospital, which is actually situated in Putrajaya. So it's all in Klang Valley, unfortunately.
Unfortunately. Okay, can I add, can you check if I'm correct, Prof. Lydia? I believe Pekeso does have a rehab facility in Malacca that's inpatient.
That's correct. That's correct. So when I talk about the hospital-based rehab facilities, is what I mentioned, the first three, and then we have got SOCSO, because SOCSO do not handle acute rehabilitation.
They don't. They normally have to vet the case before they go in as well.
That's correct.
And
so when I talk about acute rehabilitation, is immediately post-acute, where they are still very weak, they are still exposed to a lot of medical complications like deep vein thrombosis, pneumonia, but we want to start them early. Hence, you admit them in an active rehab hospital for the continuation of stroke rehabilitation before we send them out to NASAM.
Yeah, thank you so much, Prof. Lydia. Right, just to recap, early rehab is very important. There's a golden period to catch that neuroplasticity. Stroke does affect people in many ways, like you have problems with speech, movement, cognition, and you do have the secondary consequences of depression, pressure sores, chest infections. Rehab is very goal specific. It must have sufficient intensity. It's got to be task specific. You need to work with a team. So the physios are not the only therapist that normally works. We also work with speech, occupational. We will also work with counselors, neuropsychologists, as well as what we have in NASAM, also a bit of mentoring as well. Also very important to rehab is the fact that we need to prevent the secondary consequences of a stroke, which would be like isolation, loneliness, and getting weak, staying in bed and getting stiff, that sort of thing.